Today we are going to discuss about the management of hypertension in diabetic patients. I am Dr. J.K. Padhi, Director Cardiology AMR Hospital. So to start with, as we know that patient with hypertension and diabetes, definitely you have to control hypertension because the diabetic patients, they may develop heart failure, their development of renal failures. So both the two important organs to save, you have to control the blood pressure because the patient may develop ischemic CV or maybe intracranial hemorrhage. So in hypertension and diabetes mellitus are the two leading lifestyle diseases in Indian and South Asian population that often coexist due to overlapping pathophysiological factors. Obesity, insulin resistance, inflammation, and oxidative stress are thought to be some common pathways. Up to 50% of the hypertensive cases in India are diagnosed with a type 2 diabetic mellitus. In research, RSSDI guidelines 2022 provide a comprehensive recommendation for managing hypertension in patients with diabetes. Number one, as per the Indian guidelines, hypertension is defined as a systolic blood pressure more than 140 and diastolic blood pressure more than 90. Primary hypertension is mostly asymptomatic, while secondary hypertension is due to the various underlying pathology. Uncontrolled blood pressure despite the use of 3 antihypertensive medications is referred as resistant hypertension. Over 1 billion people suffer from hypertension globally, which is expected to rise up to 1.5 billion by 2025. Up to 50% of the cases of hypertension are also diagnosed with the type 2 diabetic mellitus. Hypertension presents a major risk factor for heart failure, CVD, CKD, peripheral artery disease, and there is emergency visit. Finally, there is end organ damage. There is a complex cause-effect relationship between hypertension and diabetes, which predisposes the patients to increased risk of cardiovascular complications. For patients with diabetic mellitus and hypertension, 24-hour ambulatory blood pressure monitoring is recommended to maintain BP targets of systolic 120 to 130 millimeter mercury. Use of aneroid sphygmomanometer must be preferred over digital devices. However, digital machines may be preferred for home-based measurement of blood pressure. Blood pressure threshold vary with age and comorbid conditions. Non-pharmacological management of hypertension in diabetic patients, especially lifestyle modifications, may delay the need for pharmacological interventions or may complement the BP lowering effect of the drugs. A low sodium diet, a physical activity, and healthy diet recommended to manage hypertension in patients with diabetic mellitus. Pharmacological management of hypertension in diabetic patients. ARB is recommended as the choice of therapy, preferably combination with calcium channel blockers, to manage hypertension and its resulting complications. For combination therapy, however, CCBs like cilnidipine along with ARBs are recommended. Cilnidipine is a novel effect, safe calcium channel blocker, which is established for its renoprotective effects. Combination therapy with ARB with thiazide-like diuretics also reduce risk of renal disorders, while telmisartan can be the first line of ARB for treatment of diabetic hypertensive due to beneficial effect on fast blood glucose and insulin levels. Alternatively, adelcertin with is a similar safety and efficacy profile also recommended. Thiazide diuretics can be preferred elderly patients with coexisting CVDs. ACEi inhibitors may be reduced and alternative ARBs, CVD reduction also a choice. Beta blockers may be preferred in patients with previous history of coronary artery disease, alternative to RS blockers, and patients with pregnant women. In summary, hypertension is a strong modifiable risk factor for the macrovascular and microvascular complication in diabetes. Strong evidence from clinical trials and meta-analysis supports targeting blood pressure reduction at least 140 by 90 should be below most of the adults with diabetes. Lower blood pressure is always better. Target the lower blood pressure may be beneficial in selected patients with high cardiovascular disease risk if they can be achieved without undue burden, and such lowering target may be considered on an individual basis. In addition, the lifestyle modifications, multiple medications classes are also needed to attain blood pressure goals. So both diabetes and blood pressure control is important for a patient with both the modifiable disease risk factors which can be controlled with diet, exercise, and medications. Thank you.